Welcome everyone to the first Navigating Neurological Conditions webinar. I'm so glad you're here. I'm your host, Genny Jessee, and I am a mom of a medically complex child and co-founder of the June Jessee Memorial Foundation. I'm on a mission to make lives easier for children with medically complex neurological disorders and their families. Thanks again for taking time out of your day to be here. I'm very happy to present Liz Gallagher and Nancy Kramer. Today, Liz and Nancy are going to talk about in-home therapy and how we can make the best of virtual therapy sessions in the time of COVID. Liz is an occupational therapist and has been working in early intervention for 22 years. She is trained in neurodevelopment treatment and works with children with neurological conditions, motor delays, feeding disorders, and sensory processing issues. Nancy is a physical therapist for over 30 years working in pediatrics. Nancy has worked in the hospital setting and in early intervention. She's trained in neurodevelopment, infant treatment, infant massage, general movement assessment. Another fun fact about Liz and Nancy is they were my daughter June's therapist for early intervention and often came together for OT and PT. So this is very nostalgic for me and fitting that they're our first guests. Welcome, Liz and Nancy.
Thank you.
Okay, so our first question I'm going to direct towards Liz. Liz, I know you've been working with a lot of families these past few months during the pandemic. What have you seen in terms of how families are responding to virtual therapy?
Thank you for having me, Jenny. I think it's a mixed reaction to virtual therapy. So in some ways, we all had to learn on the fly. So in some ways it offered a good opportunity for the family coaching model with which early intervention in Missouri emphasizes. But the disadvantage was for sure having just a smaller picture of what's going on. And also, we OTs and PTs, we really operate kind of by feel. When we feel an exercise is too hard or too easy, we make little changes and it's hard to always articulate or explain that to somebody else. So we made it work for many families, but it depended on the family too. If they had, 5 kids learning at home, especially in the spring, that was a lot to ask, to spend time on the computer or to try and get, in early intervention, trying to get a baby or a toddler to interact with a screen is a pretty tall order. So it worked okay. It was more like a survival kind of a thing than a move the needle forward situation. So that's how I would say it worked. That's an overview. And then I can give you some specifics of tips to make it work better too.
Yep, that would be great. If you could give some tips on how families can get the most out of virtual therapy, that'd be great.
For sure. So, of course, with the general, be easy on yourself. Just keep your expectations of your own self very reasonable, and just know that most therapists by nature are really supportive to start out, but that's, something you hear a lot. The nitty gritty of it, I think, is eyes on the prize. So really focusing on these are my goals. This is what I want to see change. Good examples of that might be, I really want my child to expand what he or she is eating every day. I really want my child, if I offer them a non-preferred kind of food, that they don't throw it on the floor or throw a fit. I really am hoping that my child will advance in their motor skills, things like that. So when we have a really detailed or even just focused goal or an outcome, our interventions can be tailored towards that prize. And there are times with some families, again, it really is going to vary by the family, attaching interventions to a routine. So at every mealtime, for example, that child, if you want them to start eating some solid food or eat more than just a very small repertoire of food, we're going to have you offer them something that every child eats, but that's attached to your mealtime routine anyway. and just be prepared for, okay, we also talked about squeezing something out of every routine. So if I offer it, I said, if you offer it, be ready. So they might scream and yell. So then I'm going to get a communication and a sensory benefit out of that. I'm going to say, oh, then you can tell me no, thank you. You can hand it back to me, help them through it. That whole intervention was just a few seconds long, but if you do it every day and learn that the expectation is you don't have to eat it, but we're going to touch it and move on, touch it and move on. That ideally is an intervention. And then, of course, the greatest thing the child might eat what they see their siblings or their family eating, then ideally that's an intervention that is going to capture some success, tiny bits at a time, no matter how we can get something out of it. Things like that, so sometimes we work really hard to attach those interventions to a routine, like I said, or just allowing extra time for that walk up and down the street. Don't necessarily carry the baby of the family for this amount of time. We're going to all have to wait on the baby for a little bit, but the interventions look different per family. And then there were some times that, as far as just sort of life hacking, the interventions, we had to actually ask families, would say, be my hands and do some of this real therapy on a ball, or scoop those knees under the hips, get the hands down. And it's just, these families were troopers. They really were. And we tried again, a lot of to send me a video. We did a lot of that during the week. I'd say, try this. And if it's hard for you to replicate or explain what you're seeing I'd say just please take a video. It's so helpful if you show me what's hard about this thing and about what changes we could make.
These are some really great tips. So to summarize, suggest parents keep their expectations reasonable and keep their eye on the prize, incorporate small interventions into everyday activities, and send videos to your therapist with questions throughout the week.
Absolutely. And really emphasis on the communication part of it. Part of our learning curve was that without those sort of natural breaks that occur in those little sidebars that occur in in-person therapy, it was just this barrage, or it could be on our parts, of suggestions. And then we'd use the last bit of the video session to, together, we'd summarize what we talked about. And it was a really eye-opening moment when the other therapist and I put together our talk and realized, we'd suggested no fewer than 25 things. I thought, oh, this is crazy. So back and forth communication, and also try and kind of liven it up. And really, it's great when a mom says to me, hey, that really worked and I saw this. But also if they say, that didn't work at all, that's not working, because it's not a chart. Anybody can look up a chart or, find that on a Facebook group or Google or something, or Pinterest or something like that. It's almost like it has to be a flow chart. Mm-hmm. Well, if you do this, if it doesn't go well, now what? Mm-hmm. Okay, that went well. Now what do I do? So it's this definitely very dynamic process. And it's one more thing added to what we're expecting of parents right now. But the communication and just being really honest with your therapist. This is too much for me, or this is we also had surprise things come up during the pandemic. A lot of kids with sensory issues, those sensory issues just went through the roof with these changes in everyone home all the time or changes to routines. So communication is vital to letting your therapist know how things are going and what changes we can make.
Okay, great. Nancy, even though you're currently working with babies in the NICU, do you have any suggestions for how families can make the most out of virtual therapy, given from a PT perspective, given your time working in early intervention?
Like picking maybe one or two areas that you really kind of want to focus on. And as you can see, Liz and I have been doing this for a very long time. So I always tell parents, I make this look easy. It's not easy. It just takes practice, but just cut yourself, just remember, I couldn't do your job for a living, and really being the parent is what's so important. So usually I like to kind of think about having like 3 things that I'll give parents to kind of do and kind of implement after we've kind of worked together. And 3 seems to be, so we kind of work through those during a session. And then at the end, you kind of review those so that you're kind of keeping things a little bit more reasonable for them. And then building on what Liz had said as well too. And thinking about how you can kind of put things into their routine. So Liz kind of talked about the feeding, and she kind of addressed like taking a walk and those kind of things. I mean, some of those everyday chores and activities are great therapeutic activities for kids as well too. So
I love how you said just being the parent, is the number one thing, and you two do make it look look easy, the therapy and the positioning and all that stuff, but obviously it takes a lot of schooling to become a PT and OT, so that is a good reminder that the parents are just the parents, so I think that's a good tip. What options do older children have that aren't, I know you're early intervention, but what do you suggest for some of the children that are not able to receive essential services through the school district, that normally get it through the school district for virtual? Like, are there private places that they can go to get support, or are there ways they can get a therapist to come into the home during this time, at least in the St. Louis area? Do you know of any places like that?
Yes, for sure. There are private therapy companies around town, as well as hospital outpatient therapy options. And, the list can be long, especially these days with so many families finding themselves without their usual therapy. So that again can create, some creative opportunities. If you can get in once, or, if you could, or just kind of, instead of getting on a regular rotation, if you have to just sort of take what you can get for a little while, then I might record it if they'd let you, write everything down, and really spread the love is the other thing I was going to say. So I have talked to so many moms, if they're in, that sort of traditional mom stays home, dad is at work all day. Well, how can we, or maybe they have a babysitter sometimes, how can we train every caregiver? How can we find out, in picking apart those routines, that First Steps always asks families about in detail? And at first I thought it was so intrusive and almost like a voyeur, like, oh, what do you know this for? But now I get it more, to say like, okay, that's what dad does. Like, that's part of the routine. Then, for example, if dad is a rough and tumble play kind of guy, or if dad is then here, how can we spread this, these interventions around? So if you have to, so for an older child, same thing. And really, I think for older kids, it's more about that, the eyes on the prize thing, or those interventions should always be outcome driven. Meaning, if what's important to you, or if your child is not developing typically and that is not expected, like we could go through the normal developmental sequence of, roll and get into sitting, and that's just not in the cards for your child, then we really want to be focused on, tell me what's hard. Tell me what you need to change. What's breaking your back? What's breaking your heart? And let's tailor those interventions there to make those improvements, we don't want to waste time. But as much as you can, if you've got, some family who can help with some stretching so you don't lose ground there, making the most of the interventions you can, and a second listener, or who can say, oh, remember, I think they said do it like this, or, oh, that's something I can do in the afternoons, and that's not possible with every family. But if it is, it feels bad to feel like we're just putting more of the weight of the world on parents, or especially like typically like a mom's shoulders, that doesn't feel good to anybody. So we want to keep our program family centered.
Cool. Okay. So this is kind of piggybacks on this other question. Is for with some of the older children, that I've gotten to know through June Jessee Memorial Foundation, some of the ones who are in where they would typically get services through special school district or in a school setting, some of them have seen that their child has regressed. They say that they've seen that their child has regressed or lost skills during quarantine and homeschooling, and they're really worried about, they felt their child was starting to make real gains and was on a path to catching up. What advice do you have to those parents who are really fearful that their kids won't catch up after this, or that they're not even with other peers, but to where they were? And that can be either Liz or Nancy. Nancy, do you want to?
Yeah. So the one thing I would say is, let's be honest, during this whole COVID, we have all regressed as people. So cut yourself a little slack. And just in general, like, as a reminder, like, stress is just toxic. Like, so for us as adults, for children, for babies and their developing brains, so finding those, first of all, like stress relievers that are going to help you in terms of that. There's also so much to be said for like the power of just spending time with your child, and like touch is such a powerful sensory experience, you know, so giving them that touch, whether it be nice hugs and, you know, holding their hand while they're walking down the street, some of the littler things, but just really having that intention can be very, very therapeutic.
The touch is huge. I mean, we get so much gain from our little guys using that touch, because you get a connection, and that opens other doors as well, calms those stress hormones, gets that brain ready to learn and listen. Couple thoughts. First of all, for the parents who are just saying, I don't mean to be dismissive in that way, for parents who are saying, I feel like they're behind, I would really encourage them to put words to in what area and what do you want to see change. And we have lots of funny sayings. One of them is, when the going gets tough, the tough collect data. So, okay, do this for me. Tell me in what way you see it. Think hard. And they'll say, well, blah, blah, blah. Okay, great. So let's write some things down. So let's see if you do this. And I like things to have a beginning, a middle, and an end. So let's see if he used to listen to books longer. He used to eat different foods, something like that. Then let's find a way to collect data in a pretty easy way, even if it's you make a chart. And then whoever's doing this with our little guy or our little girl, make a check mark, whatever, make some notes, because it'll be eye-opening at the end of a week. If I say 3 or 4 days, you tell me, let's really see where we are. That always opens our eyes to one way or the other, to we need to, you're right, we're behind. We need to, but this focused intervention is working, or, oh, it's not as bad as I thought. I think when I'm really paying attention, it's different than I thought, for sure. So one more little tidbit, OTs, all of our little sayings. And my sayings are borrowed. They are not mine. Like, I have to give credit for breaks your heart, what breaks your back. That comes from Move and Ginny Peleg. This one comes from another therapist, work the brain, work the body, work the room. And so it sort of makes you pay attention a little bit to your settings, what environmental change helps my child. So if some of our kids seem like they're agitated and irritated, well, is it a little too busy in front of them? Do they maybe changing a position, or changing where that child's high chair is, or something like that? That might be a pretty easy fix that can go a long way to not be as overwhelming to a little guy. So,
and this is my last question. And so one thing I loved about you two, and I was even looking through some pictures last night of June, and was reminded of even more, but I loved how you were able to take everyday items around my house and make them therapy objects. And I remember, like, Nancy, you took the hand towel, and got a rubber band and put it around June's neck, so as like a head support, and the Liz with the noodles in the noodles that we put in June's stroller to help position her, or even, and then Liz, I also remember you came one day with a soccer sock full of rice with a rubber band, and we used that as like a weighted object to help calm and soothe June. Are there any other items around the house that you could suggest that parents could use so they're not going out and buying other items, but that you would recommend for therapy, at-home therapy?
So of course it depends on the kid, but we use a lot of, if a child has some visual processing issues, I mean, nothing beats a Mylar balloon, and they stay inflated for 60 years, I think. And like, I mean, if you buy the Elmo one at like Elmo on Ice, I mean, that thing floats around your house for a better part of a year. They have, do you remember we took a roll of toilet paper? We borrowed that from Delta Gamma. So you can take a roll of toilet paper. And some of these are geared at some of the children who don't have as much motor control. And so we put little jingle bells inside the roll of toilet paper and wrapped it up in fluorescent duct tape, neon duct tape, because that was an easy thing to look at and hit and get immediate success. So there are so many little life hacks in that way that you do not have to spend a lot of money on. And so many of these things are born out of our family's observations too. Like, we maybe brought something expensive and they said, actually, I just use, whatever. And then also building into routines. For example, if we've got a kid, we're working on following some directions. If they see a family member feeding the dog every day, that's a beautiful couple step direction. Go get the cup, get it, now pour it in the bowl. We like to find things that hit a lot of areas of development with that one activity. Passing around food at the meal times, even if that child, involvement in meal times, whether that child really eats or not, is such a social and communicative opportunity. So you're right, using things a family has readily available and that are part of every day are big successes usually in our therapy interventions.
And building on that, incorporating like chores, like regular chores that you would do, like feeding the dog is a great example, but like laundry, how much laundry do we have? Having them carry the laundry basket. If they're not carrying it, they can push it. You can throw dirty laundry, you can ball it up and throw it into the laundry basket. Raking outside, like sweeping the floor, all of those are so great for challenging their balance and motor planning and just help you out as well. So pretty much anything around the house can be turned into a therapy tool, like a bucket. You can fill it, you can push it, you can carry it, you can stand on top of it with supervision. Of course, all of these would be with supervision. And that's just a challenge to your balance and stepping in and out of a bucket or container. Yeah.
I get a lot of mileage out of laundry baskets.
Yeah.
For sitting supports, for throwing things in, for helping to carry, for swinging. I mean, we do a lot. I bet you Nancy and I could come up with 20 therapy activities with a laundry basket like that. So that's a great one.
Yeah, you can even use a laundry basket as a bath seat. Yeah, I remember that.
Joe did that. Joe from Delta Gamma did that. That was great.
Yeah. Mm-hmm. Or even just to have the child sit in and you can kind of pull them around and they get that vestibular input. And
Great. Well, that is all the questions I have. Do you have, based on this, is there anything else you would like to, that you think I'm missing that you would like to add for the families right now who are listening to this or watching this?
Just please talk to people. Please don't shoulder it all yourself. It's easy for me or any parent to say, don't blame yourself, don't beat yourself up. But those words probably ring kind of hollow, especially the more tired you get, the more stressed you get, the more those voices might be going on inside. And all I can say is, I know that topic of self-care is overused, but if you can take a walk with somebody, if you have somebody you can talk to, we love to think that you can tell us if it's too much or reach out if you need help. I always tell my families, if I don't have the answer, I'll try and help you find it. So please don't feel like you have to do it alone and that you're a failure. I also tell my families that's the last thing I want. If I give you an activity and you didn't get to it and then you're beating yourself up, that's completely backwards of what I want you to think. I want you to think that everything you did is awesome. And if you didn't get to it, we'll get to it next time. And so I have to check myself when I'm getting excited about activities to not send that message that you're disappointing me or you're failing as a parent if you're not doing them. So
I would also say, make sure that you're using the resources that you do have. So if your child goes to clinic, make sure that you guys are going to the clinic. Hospitals are one of the safest places you can be because everybody's been protecting themselves for forever. So there's if there's a therapist in your clinic, reach out and kind of melt them for whatever suggestions and resources they might have as well too.
Yes. So. Okay. Well, this was great. So thank you, Liz and Nancy, for taking the time out of your busy schedules to be here for our first Navigating Neurological Conditions webinar. And it just meant so much to have you here again. And I miss seeing you two together. This was really fun. So, and thank you everyone for watching and learning. And if you have any questions, feel free to go to our website at junejessee.org and you can contact me there or on any of the social media channels. You can message me if you have any other questions for Liz or Nancy. Okay, thanks.
great to see you, Jenny. Thank you.
Great to see you. Thanks for all the great work that you do.